Good morning. I want to thank everybody who joins us in this studio and online. Ukraine Media Center Ukrinform starts its operation today. It's year 9 of the war and day 281 of the heroic fight for our freedom. And I want to thank the representatives of all the mass media who tell the world the truth about this war. Our brief schedule for today is as follows. At 1 o'clock we will have a special event, presentation of songs and drawing of finalists of the national selection for the Eurovision Song Contest 2023. The participants will be the finalists of the national selection, and among them Oksana Skibitsky, head of the Ukrainian delegation to Eurovision, Dmytro Shurov, also known as Piano Boy, music producer at the national selection for the Eurovision Contest 2023, Boris Pustovy, project manager for the production of the television version of the final of the national selection, and Denis Ivanov, implementation team lead at DIA. At 5 o'clock, joining us in this studio will be Irina Vereshchuk, Vice Prime Minister, Minister for the Reintegration of Temporarily Occupied Territories, and Alexander Bakumov, People's Deputy of Ukraine, and they will make a presentation of the law of Ukraine on international humanitarian and international criminal law. And today our first event is the December 1st is World AIDS Day. So joining us right now will be Yaroslava Lopatina, Country Program Director for Anti-HIV Foundation in Ukraine. And we will talk about the situation with HIV in Ukraine. What are the most widespread ways of contracting the disease? Please, Ms. Yaroslava. Good morning, everybody. Today, the estimates are that more than 250,000 people with HIV live in Ukraine, and only 123,000 of them are being medically observed and receive treatment. So about 90,000 people do not know about their HIV status, about their HIV infection, and they are the source of infection, which does not enable to mitigate the epidemic, and this is one of the reasons the epidemic is still raging on. In order to overcome it, we need to find those people, we need to detect the HIV infection and have them start the treatment, because as soon as the person is treated, they stop being a source of infection for other people. So how did the war influence, or how can it influence the epidemic of HIV? We all know that from the beginning of the year, around 1,000 new cases of HIV is being documented in Ukraine per month. It seems a little bit less than within previous years, but we have to understand that now that HIV test is not something that is in focus of communities, because people are preoccupied with other problems like survival. They try to cover their basic needs. With the beginning of the full-scale invasion, many medical institutions were destroyed, which were previously providing help to the people who contracted HIV, and the big masses of people were relocated from one region to others and abroad. Thus, now we cannot say, we don't have any details, but we know that HIV is a socially hazardous disease. It's a classic epidemic, and there are laws of epidemic, and we cannot cancel the infection just due to the war. All the epidemics, all the wars, or some economical crisis is a good environment for the development of socially hazardous diseases like tuberculosis, and the same case is with HIV. We can remember the epidemic of syphilis after the World War I, and regardless of the fact that we don't have some profound details, we can forecast that the condition of the epidemic of HIV due to the warfare, it did not improve. It cannot actually improve because we have to focus our efforts on continuation of detection of people who contract this disease, and we have to keep treating them. So, Mr. Yaroslava, what will be your advice? Who are the ones who need to undergo the test, and where should they go to? In Ukraine, the epidemic is quite concentrated. There are key groups where those peoples are broken down by behaviors. Well, first of all, those are the men who have sex with men, the people involved in sex labor, or people who use injection drugs, and their partners, as well as people who finish their terms from prisons. But now the HIV infection is spreading out of those groups, and the majority of cases is happening just as a result of sexual relations. So they need to evaluate their behavior. We have to estimate their risks, even in the hindsight. So any person who had unprotected sex in their lives should undergo the HIV test. It only takes 15 minutes and it's painless. Where can you take a test? There is a number of medical institutions which provide this service, who provide help to HIV infected people or those who can potentially be infected. There are community organizations. In Kyiv, for example, we have a mobile laboratory where anybody can get tested, and for internal refugees we created a checkpoint in Lviv, which existed before the war, but the services were only limited to HIV testing. Now the range of services is expanded. You can get HIV, syphilis, and hepatitis test, and also get a psychologist help. Ms. Yaroslava, unfortunately, there is a stereotype that if a person is HIV positive, it sounds as a conviction. If a person is HIV positive, what to do? What is the situation with the treatment in our country? It's been almost 20 years that it's no conviction. Nobody is doomed. There is antiretrovirus therapy. It does not result in full treatment, in full removal of the infection from the organism, and the person who started the treatment in a normal manner, they can continue their lives as if they would have never had it. And I will repeat myself because it's very important. The person who undergoes a treatment that does not pose a source of infection to other people. So even having unprotected sex, or just like a pregnant woman who undergoes retrovirus therapy and that they cannot bear a child with HIV, they will bear a HIV-free child. So such people are not source of infection anymore, thanks to our international partners. And regardless the war, the treatment for HIV infection is accessible to everybody, everywhere where there are trust rooms and where there are specialized clinics. People can get antiretrovirus therapy at any moment. And if another question, if it's a condemnation, no, it's not, but it's important to start the antiretrovirus therapy in a timely manner, because the majority of cases in Ukraine are still identified, are still detected on the later stages when it's called AIDS. And yes, a person which is in AIDS phase can be returned to like normal condition, but unfortunately not all of them. And many people who have the AIDS detected on later phases, unfortunately they die. We conducted the research last year in 8 regions of Ukraine, and we were interviewing 22 people who were AIDS positive, who were detected the infection on later phases, and we were trying to understand what was going on and why it was so why was it detected so late when their health was in very bad condition. Didn't those people like go anywhere? Didn't they ask for help, or did they come for some medical help? And it was found out that all those people, they were trying to get medical help. They were feeling bad, something was going on with their organisms. They were going to the family doctors, but unfortunately out of 22 only one family doctor offered the HIV test, even though it is a part of a standard medical package, free standard medical package. And when people were coming to their family doctors, they did nothing changed in their health conditions. They were going to even to private medical institutions, and nobody, again, even there, nobody offered them to take an HIV test. And they're way from the, so to say, from the beginning of this condition. It was going on for years, for 4, 5, or 6 years. Their health was deteriorating, and on one hand, this research showed that there is no clear understanding in the general public that people may have contracted HIV infection. They don't feel it. They don't regard themselves as those who may have HIV. On the other hand, there is no initiative on the part of medical personnel, or they do offer the HIV test after some treatment, after spending of some huge resources, including personal and state resources. People were paying for their treatment, for diagnostics, and when they were just were keeping coming back into the wall, they were saying like, okay, let's take an HIV test. Like one woman during the interview told us that she googled her symptoms, and the first search result was HIV test. And it's important to change this situation for so that both medical personnel and the public, they understand that the HIV epidemic is still raging on in Ukraine. It's a very widespread situation when people contract HIV. Do we understand how many cases are identified, are detected on later phases? It's 58% which are being detected on later phases. But we have to understand that we only question the survivors who had success in their treatment, but unfortunately we were not able to question those who did not survive. And if you were talking to those patients, what do they say? Why did not the medics detect the disease? The medics should have detected the symptoms. They should have understood that it's necessary. What do the patients say in this regard? The patients say that the medics, well, they were not interested in that, first of all, and secondly, the HIV infection was stigmatized, and the medics felt uncomfortable offering HIV virus to a decent person. Well, one patient said that infectionist medic called her family doctor. So this infectionist, she turned out to be like non-neglectful. She called the family doctor and she said, like, you see, your patient has clear symptoms, papillomavirus, and very other obvious symptoms like high fever within month. And the family doctor said, I could have never responded that a person with two higher educations may have a disease like that. And another respondent, she came to understanding that she may be HIV positive in the AIDS center. She came to her family doctor and asked to apply to the AIDS center, and she was responded by the family doctor like, what's wrong with you? It's only drug addicts who go there. So this is kind of stigmatization, and the people are being referred to the categories of drug addicts or prostitutes. So people don't want to end up in this category even if they had some episodes of provision of sexual services or using injection drugs. They don't want to be labeled like that. It's a very high level of stigmatization, not only among the medical employees, well, because they live in the very same society as we do, so it's more a characteristic, unfortunately, it's more a stigmatic characteristic in our society. It's not only the problem of Ukraine. Recently, there was research of the same kind in the Western Europe, and which proved the high level of stigmatization over there too. So we're not unique, but it does not necessarily mean that we can continue to treat HIV, to regard HIV infection like this, because the epidemic is still on. Ms. Yaroslava, under the conditions of war, is there enough medicines to treat the infected persons? Yes, the medicines are quite sufficient. Unlike, for example, the period before the war, it was not it was not enough. The medicines did not suffice, but there were problems with procurement, and people were issued their doses of medicines for like 2 weeks, so it's enough for everybody. But now, thanks to our international partners, we received a sufficient number of medicines, and the patients can receive as much as they need for 3 months, for 6 months, and even for 1 year. Our doctors now regard this issue with understanding. The person can undergo monitoring in Ukraine and then go abroad, so the medicines may be issued for longer terms. Dear colleagues, your questions Ukrinform, Natalia Molchanova. As you mentioned, doctors not always or maybe even never offer to take an HIV test. On your opinion as an expert, how can we change this situation? Any promotions among the youth, among the school children, will there be successful and efficient to prove that HIV testing is not something dangerous, and in view of the problem of the relocation of large masses of population from one part of Ukraine to another or even abroad, and is it purposeful on part of the government to make it mandatory for the doctors to offer such type of tests? Because in our program it is said that the doctor offers these tests at their own discretion. Do people need to undergo those tests on a mandatory basis? Well, thank you for your question. It's a little bit complicated, but yes, if we start to work with medical students, it will change the situation. Like yesterday, for example, we were telling the medical students about the infection, and I was happy that our youth does not neglect this problem. But it's a long game. What we have to do now, I personally am against any mandatory things. It will not result in anything good, because it will create resistance. But we have to explain to the public that it's normal to take an HIV test if you had risks previously. But who did not have risks previously? For example, somebody who never had sex using condoms, or people living in monogamous relations for years. But all the others, at least once in 3 years, even if the person doesn't fall into the risk group, if you have symptoms, you can take a test. And if you are honest with yourselves that yes, I had risks, you don't have to interrogate anybody. So yeah, in that case, you better take an HIV test. And on the other hand, we have to explain it to the doctors. We do not have mandatory testing. Well, remember, there was a mandatory syphilis testing previously, but unfortunately it did not change the stigma. It did not change the attitude to the people who were detected as those who contracted the virus. If somebody is being tested on a mandatory basis and the medical worker says, okay, this person is a prostitute or a drug addict, the person will be under such stress that they will never resort to treatment. So to have everybody tested, to have everybody treated is not a proper answer to this question, not a proper response to this problem, because if a person results to be HIV positive, we have, like, without condemnation, we have to demonstrate that we don't condemn you, and only then to direct such a person to the specialized institution. Any more questions? Well, yeah, one more question. Since now a lot of people left abroad, and you remember that you mentioned that they are issued those medicines, and now that the people stay abroad for indefinite term, how do those people who undergo treatment using antiretrovirus therapy, how can they get the same medicines abroad? Well, they can get those kinds of medicines abroad for free. The persons live abroad on a legal basis. They have insurance and they can get this antiretrovirus therapy. Nobody refuses it, but the European system is very different from ours. And our system of help to the people with HIV is different. Like, people find themselves in an unfamiliar situation abroad. Their Western system is a little bit more bureaucratized. For example, we have a trust hotline where you can get advice, you can get consultation, and specifically to help people like those, the consultant gets in touch with clinics in Europe who provide support to the HIV infected, and in the hand mode they were helping the patients to find a clinic and to find a medical worker, and it was very important to provide people with the support like that, like telling them go online, read it. So even for those who speak foreign languages, it was sort of difficult even to those who live in those countries abroad. So people there were cases where people were receiving the antiretrovirus therapy at the places of their current dwelling abroad, or people can come to Ukraine once in half a year and receive the medicines here. I thank you. I thank you, Ms. Yaroslava, for this profound and holistic interview. I will remind you, dear colleagues, joining us was Yaroslava Lopatina, Country Program Director for Anti-HIV Foundation in Ukraine. I will remind you, at 1 o'clock we will have special event, presentation of songs and drawing of finalists for the national selection for the Eurovision Song Contest 2023. So bear with us, trust in our armed forces. Glory to Ukraine.